Hello, dear folks. Welcome to the show, Jack Chow on the East-West Show with G&E TV. Busy at work, busy partying, busy having fun, doing whatever, playing cell phones, whatever. You are sitting there long time, hours after hours, this being the challenge facing the digital time now. I often come across people complaining about their back pains, about neck pains or back pains or even lower back pains because of long hours, just buried in the fun of the digital time. So now, on one hand, just like exactly every coin has two sides, right? We have the right side, we have the left side. And so is the digital time. It has a positive side. It shortens the distance, shortens time, shortens everything. You can do everything in a click like that. And the dark side being that you are so enslaved to the time, to the gadgets. So how to protect ourselves, how to protect our loved, nothing but only backbones, which is the spinal system, starting from here down all the way to my bottom. So we get to talk to some professionals. So that's why, as a special program, in the answer to many calls, to many, I'm a guy that the public trusts. They sometimes call me, Jack, can you do something like this? Can you do something like that? And we need information. So to get to the answer of those requests or recommendations, we have invited today Dr. Chan, Lilian Chan of USC, to come here to shed lights on this big issue. Dr. Chan, welcome to the show.
Thank you.
All right, good.
All very good.
Yeah, right, all right. So you're saying my introduction is very good.
Yes.
All right, good. All right. Dr. Chan is not only a practitioner of physical therapies in the area, but also she's got very high titles. She is a designated therapist specialist for the Chinese Olympic team. And also she's the first one that brought the American Western system of physical therapies. Well, why don't I just stop? You go ahead yourself with your own story, please.
Okay. So my name is Lilian Chen. I am native of Chinese. I graduated from China, East China Normal University, 华东师范大学. So 1996. So 1997, I come to United States to continue my sports medicine education. So get a developmental kinesiology for my master's. Then I went ahead to USC for Doctor of Physical Therapy.
You got your doctorate in USC?
Yes, it's a clinical doctor degree. Yes.
Good.
So after that, I had the opportunity to work with Chinese Olympic Committee because it was 2008. The International Olympics held in Beijing. Ever since then, I was appointed as their physical therapy rehabilitation team as a counselor. So I go back and forth to help with their education for their physical therapy and also with the athletes. So that's my general background.
Okay. So what do you do in the United States?
We have a private practice in Acadia in the South Pasadena. So we treat a variety of patients, from neurological patient to orthopedic and sports. So
that means you're involved not only academically but also practically.
Correct.
Right, in the treatment.
Right.
In the treatment of your patients.
Yes.
Quote unquote patients.
Full time, yes.
Yeah,
we're treating patients.
I see.
At the same time, I'm involved with USC's education, and right now we actually bring the USC orthopedic courses to China, because in China we don't have the same Western physical therapy education, the same as Europe or Australia or United States. So during the last 5 to 6 years, I've been devoted a lot of time to do a lot of clinical teaching, including the didactic courses.
I see.
Also, we go to their rehabilitation center to hands-on to train a lot of rehabilitation specialists.
I see. I did some homework. I read your bio. Well, very impressive bio, by the way.
Thank you.
And I noticed one part that you were the first one that brought the Western rehabilitation concept and practice to China. To what extent did you do so?
Yes, good question. Because, like I mentioned, in China we have rehabilitation, but in China we don't have Western style physical therapy.
You mean they don't have?
They don't have that exactly.
Okay.
China doesn't have at the time when I went back 2008. So people wasn't sure what I was doing, and then so from that point, nowadays modern society, besides the digital, also, people become more and more active with, all the sports. China started open to the world at end of 70s, early 80s.
I see.
So during this period of the time, I think, people have more awareness of being involved in activity, and then that involves more injury. So biomechanically, the science wasn't really very actively involved in the general practice in traditional Chinese medicine. Therefore, we had been involved a lot of great professors and clinicians, involve them, come with me to China to help with their athletes, at the same time help with their rehabilitation specialists, because the time we go over there is limited. However, we need to train them to do what what they can do, so they can bring the Western style into the traditional style combination. Hopefully, people get a better service.
I see.
And also at the same time education.
I see. That's quite significant. Prior to the show, when I started talking to my group, my production group, they get excited. Oh, wow, that's an issue you're long waiting for. We all need that. And some of my colleagues even told me there's none of our employees or nobody you come across that does not have a spinal problem, or to whatever extent.
Sure.
Okay. So almost everybody has a problem. And this is, Dr. Chen brought me a picture. This is how we are enslaved. Yeah, look at the poor guy. So as a matter of fact, it's me, it's you, it's everybody. We are here exactly doing the same thing on a day-to-day basis, hour-to-hour basis. So, well, this is really something of super importance that will bring some understanding to our fellow earthlings, fellow earthlings. So this is the serious problem we are facing, right? As mammals, so we really have a big job to do to take care of our spine. So without a spine, well, a healthy spine, you're really trying to suffer a lot. So now, for that, I have a little request. I know that in preparation of the show, you brought a model here. You call this a model?
Yes,
How do you call it?
How about George?
George, you call it George, right? You brought a George here, and can you, okay, give us some understanding about how structurally or physically the human spine are constructed, please.
Sure.
Can you?
Yes,
using this?
Absolutely.
I really want to take a look inside myself. I can't do it until
inside of yourself. There we go. We have a spine. Okay. From side view, and we have this is our neck. Okay. So each level we call that a vertebrae. In the cervical, we have 7 levels, and then we go to the thoracic spine, which is 12 of the vertebra. And then come down to the lumbar spine, we have 5 of them.
I see.
So underneath of the spine is the sacrum. So we have this, we call that tailbone, or in the common language. The tailbone is right here, and this is our sacrum. So, and then we have the, we call that, SI joint, and so this is sacrum, so it's the hip joint. People usually talk about it right here, but this is the SI joint. So this whole thing provide a spine system, along
Supports
with
the body.
ribs.
Supports
Yes.
the body.
Support our body.
Yeah, or you look like a jello. A jellyfish.
Jellyfish, yeah, with the spine, if it's not strong, if it's not healthy, obviously we have a lot of problems.
All right.
Because, well, you know, the spine, we all know there's a lot of nerve come out of the spine. The lower cervical is innervating all the upper extremities.
I see.
And lower back, lower lumbar spine, there's a lot of nerve come out to innervate all our legs, all the lower quarter muscles. So, and the spine have this spinal cord that provided a very nice dural and a very nice spinal cord protection along with the vertebra. There's a hole in between. So that's our nerve system, you know, coming down. So it's very well protected.
All right. Okay. Very good. It's good to take a starting understanding that of our body by looking at this dear George. So let's take a short moment out. When we come back, we'll continue talking about the structure of the spine. So hold on with us.